Hello, my name is Isa Farrell, and I'm delighted to speak today at the MIT A+B Applied Energy Symposium. I'll be presenting my lab's recent work on community energy infrastructure, point of service clean energy to serve the food, water, health nexus. Between 2013 and 2018, the number of refugees and other displaced people around the world grew at a rate of nearly 12% per year, culminating in approximately 16 million people having lived in temporary settlements for 5 or more years by 2018. These displaced communities face daily challenges of food security, insufficient access to clean water and sanitation, and limited medical care. Weak infrastructure and poverty compound their temporal and political uncertainty. However, refugee camps and other zones of humanitarian intervention are among the hardest to plan for, given the operational complexities, both immediate and protracted, associated with infrastructure deployment and the maintenance required. Beginning in late 2019, the COVID-19 pandemic has only aggravated living conditions, not just for these populations, but for all living under conditions of weak infrastructure provision, by disrupting supply chains, not only for medical equipment, but also for the provision of basic needs like food, water, freedom of mobility, and communication. The following research explores how innovative energy solutions can improve livelihoods and resilience across communities in East Africa at the food, water, and health nexus. More specifically, what is the potential reach and impact of containerized community-scale infrastructure deployments to serve water treatment, milk chilling, and health clinic needs in under-resourced communities in Rwanda? This analysis by the Renewable and Appropriate Energy Lab at the University of California, Berkeley is contextualized by the experiences of Off-Grid Box, a social enterprise that has deployed nearly 25 identical containerized infrastructure solutions in Rwanda and approximately 50 others around the world to date. Many of the images you'll see here in this presentation were taken by one of our co-authors over the past month as we continue to collaborate with Off-Grid Box to improve service provision for Rwandans. Off-Grid Box has been active in Rwanda since 2017 across a diverse spectrum of communities. While some boxes are installed in truly off-grid communities without national grid connections, the majority serve urban or peri-urban markets. We employ a variety of technical, market, and demographic data from Rwandan sites to provide further insight into containerized infrastructure approaches towards serving distinct communities' needs in a sustainable manner. Containerized systems have been used for decades for various remote applications, particularly for rural telecommunications spaces. The benefits of such systems over traditional utility models, like grid extension, include the speed and ease of installation, cost competitiveness, semi-permanence, and lastly, modular stackability. The container form factor is a key feature of these delivery advantages, particularly in terms of design and operational efficiency. Thus far, the academic literature on the impact and potential of containerization on energy delivery principally examines the benefits of such an approach through decarbonization for short-term, urgent need contexts, replacing the traditional diesel generators. Less has been analyzed about the unique temporal and spatial degrees of freedom offered by containerization, particularly for the provision of basic infrastructure needs at the critical food, water, energy, health nexus for fast-growing or under-resourced communities over longer periods of time. Each of Off-Grid Box's containers is approximately 8 square meters, and inside the box are 12 PV modules, lead-acid batteries, as well as a charge controller and inverter. For water treatment, several configurations have been deployed, but most boxes include a tank, gravity-fed filters, a pump, and UV light. Each box is also equipped with wireless communication module that serves to provide system monitoring and as well as a Wi-Fi hotspot and data services locally. It only takes 4 hours to set up a box on site. Each box is staffed with a local box keeper, agent, and security guard responsible for the maintenance of equipment and communicating with headquarters around production and distribution of water and power banks. 6 boxes serve rural clinics in partnership with the government of Rwandan's Ministry of Health. In contrast to other markets where off-grid box operates on a build transfer model, the model in Rwanda entails developing revenue streams at each site that can improve system unit economics. The key contributions of this paper lie in the unique comparability of such identical deployments in terms of techno-economic impact analysis, as well as novel insights into the rapid changes in settlement morphologies that characterize African urbanization. Such contributions are inscribed in the broader imperative to reach sustainable solutions to the challenges facing humanity at scale, from universal access to electricity and water, to the future of utility service provision, and to infrastructure deployment models in emerging markets writ large. This analysis outlines and discusses 3 specific use cases of the off-grid box system. For water, we examine water treatment. For food, we examine milk chilling. And for health, we look at powering, lighting, and communication and appliances at health clinics. For each use case, we investigate both the optimistic and realistic scenarios of impact. The realistic scenarios employ data from specific off-grid sites and operations, representing case studies directly from the field that provide insight into opportunities and barriers which such service provisions entail. The optimistic scenario addresses the total impact that a box-like containerized solution may have for this use case, given its theoretical maximum reach within existing design constraints. We then discuss key findings and draw from the case studies to offer reflections on the opportunity for massively scaled up containerized infrastructure approaches. In each optimistic scenario, we estimate that an off-grid box can produce 12.5 kilowatt hours per day. This estimate was calculated assuming 5 hours of full sun per day, negligible temperature effects, maximum power point tracking, a D-rate factor, and assuming that all the energy produced is utilized within the day with a 3.5 kilowatt hour battery. We then calculate a levelized cost per kilowatt hour of 36 cents per kilowatt hour over a 20-year lifetime. These scenarios assume that all the energy from the box is devoted fully to a specific use case considered. In each realistic scenario, we combine simulation results with on-site data to estimate that a box produces over 8 kilowatt hours per day on average. Here, we calculate the levelized cost of electricity to be 55 cents per kilowatt hour. We acknowledge that these scenarios do not factor in several specificities related to the deployment of a box, such as site-specific transport costs. However, they do provide a baseline for assessing the impacts of perhaps this unique containerized energy water solution, as well as indicative costs and opportunities to scale up according to local demand. In terms of water treatment needs, unsafe water remains a leading risk factor for disease in Rwanda, where diarrheal diseases cause an estimated of 10% of total child mortality. Lack of access to safe water has additionally been linked to broader social outcomes, such as infant stunting, reductions in school attendance, losses in economic productivity, and undue burden on women of time spent collecting water. Nearly half of Rwandan households spend over 30 minutes procuring water, with access rates aggravated through mobility restrictions due to COVID-19. WASAC, the national water utility, has also reported significant losses through the pandemic, on top of a systematic and widening chasm between its clean water production capacity and the rising demand driven by rapid urbanization. Using an estimate of drinking water needs of 4 liters per day per adult, A box at full utilization could fully serve over 2,000 individuals a day in our optimistic scenario, at a levelized cost of 24 cents per 1,000 liters. For perspective on the challenges of achieving full utilization through a for-profit distribution model, we draw on historical data from the box at Musanze, a large city in the northern part of the country. Between January and February of 2021, 28,000 liters of water were produced for packaged drinking water sale, equivalent to satisfying the full safe drinking water needs of over 100 individuals per day. Rwandan's dairy industry and associated value chain for milk present opportunities to reduce food insecurity and poverty by increasing household incomes and addressing nutritional needs. Several Government of Rwanda initiatives recognize the importance of the dairy industry in these roles, including the 1 cow per poor family and 1 cup of milk per child programs. The LIDIC, wherein young children in school receive a cup of milk at least 2 times per week throughout the school term, is reported to have increased enrollment and attendance and to improve student health status. Milk bars, as seen on the left, are a common sight in nearly every town. One way that containerized solutions for energy access can facilitate improvements to the dairy value chain is by providing milk chilling points. Providing collection centers with adequate chilling can provide significant benefits in avoided spoilage. In 2007, nearly 35% of the 160 million liters of fresh milk production in Rwanda was lost to spoilage. Importantly, in areas lacking grid electricity, renewably powered chilling units can replace the diesel generators that would otherwise be needed to sufficiently chill milk received at the collection center to the recommended 3 to 4 degrees Celsius. In our optimistic scenario, if an off-grid box used all the energy produced towards milk chilling using a Promethean rapid milk chiller, as seen on the right, it could serve the milk chilling needs of over 1,600 people per day. We calculate a levelized cost of 1 cent per liter of milk. In our realistic scenario, a box could serve the milk chilling needs of nearly 1,100 individuals and sell 7,752 liters per month with a levelized cost of 2 cents per liter of milk. At least half of the healthcare facilities in Rwanda lack stable electricity in 2017. While there are indications that this has significantly improved in recent years, issues remain with the maintenance of installed systems in areas designed for mini grids or standalone PV. Clinics outgrow the capacity of existing solutions installed, driven by rapid urbanization and relocation that can rapidly double demand. Rural outpost clinics are particularly undersupplied. These facilities typically focus on the most common ailments like malaria, tuberculosis, but also provide services focusing on maternal or child health, as well as first aid. While rural clinics demand typically averages 10 kilowatt hours per day, principally for lighting and lab equipment, vaccine refrigeration, as seen in the middle, can also represent a significant load, a need which the WHO, World Health Organization, expects to rise 8-fold or more in the coming decades. Currently, 6 upgraded off-grid box systems are deployed at separate health clinics across Rwanda to power lab equipment from computers to vaccine fridges to infant warmers. Each clinic's total daily consumption was estimated before and after connecting to off-grid box. These upgraded systems supply the entirety of each health clinic's current demand for core operations, thanks to the additional battery storage deployed at these sites. While remote monitoring of these systems indicates that clinics and heaviest loads utilize 60% of the energy that the box can provide, such modifications demonstrate that the need or ability to use specific medical equipment at a given site can be met by scaling up or down specific components of the box based on capacity or resilience requirements. This design choice reflects the ability to customize on top of the standardized solution, indicating a large potential for off-grid box to increase the number of individuals served by the health clinics or to power additional equipment for the provision of health services. This work presents preliminary impacts for off-grid box, a decentralized, containerized energy infrastructure provider for 3 applied use cases at the food, water, health nexus. Our analysis reveals that boxes can be cost-effective on a life cycle cost analysis per refugee basis compared to other delivery modes, but with the additional benefits of transportability and repurposing. It remains challenging to identify universally applicable use cases at this nexus, given the inherently locally specific needs. Milk chilling, for example, though attractive in our analysis, only makes sense in certain locations based on the market needs. There remains significant work to be done at the multiple intersections of energy and economic development. Few studies, for example, explicitly look at the impact of electricity on health outcomes. Given the poor electrification levels across rural or remote health facilities, not only in Rwanda, but also across low-income countries, our results indicate that a single off-grid box can significantly improve utilization of medical equipment at remote sites, from basic needs like lights for nighttime activities to critical operations like infant warming machines, life support devices, and vaccine refrigeration. Particularly important in the context of anticipated global 2019 COVID vaccine rollout. Overall, while the costs of providing services at the food, water, health nexus through containerized energy modalities are still quite high, the majority of cost reductions are expected from scaled up procurement. Rocky Mountain Institute estimates that at scale, containerized solutions can bring down the levelized cost by 11 cents per kilowatt hour, yielding knock-on effects for the use cases such as those examined here. Further work is needed to investigate the full spectrum of community impacts at sites for which boxes have already been in operation for multiple years through fieldwork and against the backdrop of COVID-19 stabilization and recovery. With a 20-year expected lifetime, over 24 deployments in Rwanda and counting, off-grid box represents perhaps the best data set for benchmarking a variety of community infrastructure needs and costs in existence. At the terawatt scale, the deployment of such modular, containerized solutions could not only structurally address electricity needs, but also radically change the landscape of utility service provision models, as well as possibilities for productive uses of electricity at the food, water, health nexus. We thank our generous funders for supporting this applied needs-based research and open the floor for questions. Thank you.